Hey everybody, thanks for joining us. Sorry it's a little bit darker than usual right now. We're in a hotel room and it's the best lighting we could come up with for the event. So anyway, let's go ahead and do questions and answers. If we have time, we'll go through and do a protocol, but first let's do a little Q&A.
Independence, 52% to 47% from Republicans. That's 30% of the election.
Megan, did you have a question?
Okay, yeah, I didn't know if I should just start talking or be called on. Yeah, I need some help. If you have an oil in a pattern or maybe even like a multi-step process for a phobia. I had pretty mild claustrophobia for, I don't know, 10 years. I just didn't go in elevators very much. It was under control and now it's just blown up. It's like, oh, I went for a massage and I had to ask the person to leave the door open a few inches because I thought I would just get shut inside the room for no reason. And like, I just went to the store the other day. I was worried about being locked inside. Like, it's totally gone crazy.
Was it ever this bad before?
No, not even close.
And has there been something that's happened that like triggered it, or it just kind of snuck up on you? And
mostly snuck up on me, but the thing that happened was at the airport. I was at the Seattle airport. I had to take that train just to get to the other gates. And I just totally, I had like a terrorizing experience. Like I can't even, it was like someone had a gun to my head. That has never happened to me. I felt like my life was ending. It was like under a minute in the train. I mean, I got out once, took a break, like got back in. I could barely, I almost went home and didn't take the trip. I don't know what the heck.
And is it your mind starts coming up with things, or your body just is reacting and it just is having a reaction?
It's like my body. It's my body. I don't have any rational thought or just anything.
Okay. So it wasn't like thoughts racing through your head or anything like that?
No. Just panic. Yeah.
Let me sit with this for just a second here.
Thanks.
How long ago did this first happen? Like, you know, not the recent thing, but like, you know, years back you had this issue.
I mean, so as long as I can remember, I've never really loved to be in an elevator. I always felt nervous, but it was just nervous. And I would ride in them and then get out and everything functioned fine. And it was not really a big deal. And then around the time my son was born, around 9 years ago, I remember the first time I was like, oh, that was awful. I'm not going to be using elevators anymore. And I mostly haven't used them in about 9 years. But it was just elevators. And then I guess we did Disney World in the spring and I did have to take this train to get into the Disney park, just as like a fun little nice modern looking good train. And I really, that was super hard. And some of the rides, like the little kid rides, but they were kind of, you felt like you were underground. I felt like I was going to be trapped in there. So that got it going quite a bit. And then last 2 weekends ago at the airport, I've never had panic like that in my life.
Okay. You don't happen to have the blend threshold, do you?
No, I don't think so.
Okay, let me look up the formula and see what's in it and see if we can just find you a single oil to use. Right off the bat, threshold would be
well, I can buy it.
Saffron. Yeah. You have saffron. No. Galbanum might work.
Galbanum, yeah. I have it.
Let me see what else, if there's a better choice here. Give me just a sec.
Yeah, and I've done so much pranic healing. So something about pranic psychotherapy is like just not addressing. That's the other part.
Sorry, Megan. We're going to troubleshoot still for Greg's computer here. Do you have I'll let you guys talk this way while I try to do the other thing.
Do you have ginger lily or ambret?
Ginger. What was the second one?
Ambret?
No, just ginger lily. I have.
Ginger lily. Okay, let's use ginger lily. Like singly, ambret would probably work better. Threshold would work the best. Ambret would be the second choice. Ginger lily, or even saffron or galbanum, but we're starting to like diminish the impact. And then the pattern would be the cranial pattern. You know, the one that's throat minor, back throat, jaws.
Yep. I have it saved
temples.
on my phone.
That one, and then the lower centers. The one that's navel, spleen, Mingmen, sex, basic soles of the feet.
Yes.
That should do it. You might have to do it several times. Usually with phobia, I mean, you kind of know this from pranic healing. It usually can be like some sort of related to some sort of trauma, but the thing that we don't always factor in is that might not be a psychological trauma. It actually might be tied to like a physical trauma, like an injury when you're little, or some like just little weird, bizarre thing that you have the injury, the body had the reaction, and it keeps getting triggered by that. So one of the things that I would do as a secondary treatment is there's a very inexpensive oil called Quiet Mind. And it's to also regulate the endocrine system, but part of what it does is it does quiet the mind, like what the label says, but it diminishes the tendency to get triggered.
Okay.
And so that could be something that you just do like as prevention, like you're going to go into a situation like that. But that you don't even really have to do a pattern. You can just take 2 or 3 drops internally. I do it just all the time, just to keep myself from getting like triggered with a stress response, like when I travel and stuff, because a lot of times, like mentally and emotionally, I am not stressed at all, but my body just, you start getting on the plane and people around them, and my body's just like,
the plane.
It starts having a weird reaction. The other thing that I would look at is like the breath. And like any time like you're starting to have, because like a phobia can turn into like a panic attack. Because the phobia is so triggering that it's way beyond anxiety, and so normally we'd look at like, slow down the breath, deepen the breath, do things like hyssop or larch or something like that. But in a situation like that, I would look at it from almost like a point of view. It's like slightly cardiovascular, it's slightly just the respiratory rate, but one of the oils that can be really good in a situation like this with just like really short, rapid breathing, and you probably notice that like when it starts to happen, you're starting to breathe like real shallow and real rapid, because your body's going into a stress response. And or not a stress response, a trauma response. Like it's kind of reliving an old trauma, and so ylang-ylang actually can, like if you just start inhaling it like in the moment, ylang-ylang can actually calm down the respiratory rate, and it actually can calm down the heart rate. Ylang-ylang is something you would use to treat tachycardia, which is like your pulse is like way above 100 usually with tachycardia. And so I mean, if you look at like what happens with an anxiety or extreme anxiety attack or a panic attack, your pulse is just through the roof. you know,
Yeah.
and the breath is like short and rapid. And, you know, it's a trauma response, but the body got triggered by something in the environment. And so again, there, you don't even really need to do a pattern. You could just take long, slow, deep breaths. And the other thing that you could do with the lang lang is you could put like 3 or 4 drops in water and just chug it, you know, just like down it. That would probably slow down the breath. But, you know, panic attacks, you know, if you can slow down your breath and sometimes redirect your focus, sometimes it'll pass. But you know, you're definitely having like, you know, a phobia / panic attack. Even if you get the panic to calm down, the phobia part is probably still in play and won't let you relax. And so going back to the thing we talked about right off the bat, the ginger lily, the ambred, the threshold, that should actually help clear like the issue at hand.
Okay.
You know, the thing that I always thought was confusing to like practitioners and everything, you know, even when I talk with psychologists and stuff, is people view it as a psychological issue when I mean, 90% of the time it's physiology. It's not even psychology. It's just.
I've been wanting to see a practitioner, but I'm like, who's gonna get this?
All they're gonna do is, honestly, all they're gonna do is medicate it. All they're gonna do is they will tell you to either suck it up and deal with it, or they'll give you, you know, some sort of like Xanax or, you know, something like that to use.
Which I thought the elevator ride is like 5 seconds, and then I'm on pills for the rest of the day.
Here's the thing with the Xanax. The Xanax will calm you down, but it's like if you keep using it in times where you're having anxiety and panic, it almost kind of starts to be like this emotional reinforcement of the trauma, you know, the phobia itself.
Yeah, like
and a lot
of
times what happens is it escalates. It escalates. And so I mean, people need it sometimes. Like I'm not saying don't use it, but I'm saying like it's not the best remedy for treating it. And so even if you saw a psychiatrist or something, because that's who would give it to you, it's a psychiatrist.
Yeah.
Or sometimes your family practitioner might give it to you, but usually it's a psychiatrist that gives it to you.
Yeah.
It would be low on my list of things to do.
Yeah,
you know, there's people who have really substantial.
So much chronic healing that I'm like, maybe I just need to get a pill at this point. It's just getting crazy.
I would say, you know, chronic healing wise, I would say, you know, clean the brain, do delicate regeneration on the brain.
Okay.
And then it's really cleaning the lower centers, like, you know, the navel, the main men, the spleen, the basic, you know, just go through and clean out those lower centers. And not so, I mean, you can clean the solar plexus, but not so much the solar plexus, but the diaphragm directly, you know, because some of the thing with the diaphragm is when it's contracted and tight, it really will impact the autonomic part of the nervous system, which is fight, flight, and rest and repair. And when it's really contracted, it's really easy for your body to go into fight, flight mode. It's really super easy. And so this is going to be probably one of those things where you're not going to do one thing and flip the switch and you go, I've got it. You're going to have to do like multiple faceted approach. And usually, I mean, sometimes we need to make adjustments, but usually you can make it go away. Like just release it where it's just not an issue anymore. But it sometimes takes like playing with it for a little while. Like you try this, you try that, you do this, you do that, and that it hasn't gone away with treatment. In my book, that tells me it's physiology and not psychology.
Yeah.
You know, if it went away, I'd say it's probably tied to some mental process or thought process or an old traumatic event or something, and it diminished and it went away, but that you're having an escalated response. For me, that's physiology. And so, how are your hormones? Are you having any sort of hormonal fluctuations?
So everything's great. I actually just had a blood test to celebrate turning 40. I'm like, okay, let's see what's wrong. Everything, like 20 things.
Estrogen's fine, progesterone's fine, thyroid's
everything
fine.
Was good, average, yeah.
Because that would be the next thing. I was like, it could also be an endocrine issue, and so that you don't have that, it's just something that's probably getting triggered with the immune system or your nervous system.
Okay.
Usually, in like anxiety and panic, I put in anxiety, and I'd even put phobias in that. It's usually, when you look at the physiology, it's usually either immune, nervous system, endocrine system, or the breath. Like those four things are usually, I usually explore those before I ever go to a psychological reason. Like, because it's so many times, it's just physiology.
Yeah.
You know?
I still haven't sorted out my breath. I've been doing the sinus pattern with the hyssop and everything so much. I just don't breathe right at all. I just don't take full breaths unless I completely pay complete attention to each breath. So maybe I should do more of that.
Try the Lang Lang. Like the Lang Lang could actually be helpful. You're having a hard time taking a full breath. Yeah, it's probably breath related. Hyssop, large. Let's see how this goes, and then you know, I would treat it really solid for like kind of daily for about a week, and then you know, step inside a closet or something and just see if it triggers you.
Yeah.
And then if it's diminishing, good, and if not, you know, send us an email or do the next Tuesday night or something, and let's revisit it. But you know, it's if we don't get it right off the bat, don't get too frustrated. It usually takes a bunch of like back and forth before we nail it. Like every once in a while we nail it right off the bat. Like you know, always shoot for that. But
sure. I got all the time. I mean, I just told my husband, I'm like, I just want to be able to take a family vacation this spring.
Yeah. Oh, I hear you. So the other thing you can do with like the pranic healing is, you know how you do the whiteboard? You know? Do the whiteboard, but see yourself in different scenarios where you're like, okay, I'm in an airplane, I'm in the massage room, I'm in a closet, I'm in a weird hallway, and then lots of dark blue, more emphasis on the blue than on the electric violet.
Okay.
Because really what you're doing is you're calming down the body's responses.
Yeah.
And you know, if like what we do doesn't work right off the bat, then we have to look at projections coming from the body that is usually more immune system related, but it's feeling like it's in danger, and it's you know, it's sending some things out, but it's causing like a kind of like an agitated state and an agitated response that just makes the body overreactive to any sort of stimuli.
Okay.
Yeah. So, I mean, really, I would really, I know I keep saying this, but I'd really emphasize that it's probably more physiological than psychological.
Yeah,
so
I believe you because I'm pretty good at pranic psychotherapy, not to mention I had feelings from some very experienced instructors, and it didn't even make a difference. I couldn't believe it.
Yeah.
So I believe you.
Yeah.
All right. I got it all written down. Thank you so much. I'm so grateful.
So keep us posted. Like, you know, good or bad, I'd like to hear what happens.
Yes. Thank you.
Okay, and give me just a sec, guys. I'm actually going to remute myself and try to get Greg back in here. I just have to get everything muted on my end. Oh my gosh, sorry. That was technical difficulty as well. Go ahead, Linda.
I'm always shocked when I raise my hand and then there you are calling on me. Hey, Greg, I'm back.
Hey, Howard.
I'm good. So the black spruce should arrive tomorrow with the I have a little Schizandra. I've already started that. And Basil, this was all for my adrenals.
Right.
So I just wanted a little icing or a little extra boost because last Thursday, I want to see your face. There we go. Last Thursday, somebody drove into me. Now, the good news is that it could have been a lot worse. It was from the side back.
They drove into your car, or they hit you while you were
into my car while I was driving. So I was in a car accident.
Wow. Okay.
And it was a side to side. I've had whiplash accidents before. This was not as bad. I found a fantastic chiropractor who's a healer, and he's very mind body. He's fantastic. Good. So I just would like, I mean, my spirits are good. And since that first chiropractic appointment, I actually feel safe on the road again, driving.
Good.
So I just would like a little extra support from you in terms of oils. I have quite a collection, but maybe something I've got will work, or maybe there's something else, or maybe just the adrenal support.
Yeah, so right off the bat, I do a couple of things. The adrenal support should be helpful. With any sort of whiplash, we always want to treat the sternocleidomastoid, even though you got hit from the side, which also impacts the diaphragm. So again, long, slow, deep breaths with just hyssop or larch or like Sitka. Even if you just use the black spruce that is going to be there shortly, you could start doing that. That would be helpful. Hyssop or larch would be my first choice.
Okay, and I have lots of hyssop, so I can start with that.
Yeah, perfect. So start doing some long, slow, deep breath, because any time there's a whiplash, your neck tightens up to protect your cervical spine, and so that tightens up, which eventually throws the diaphragm into a spasm. And so if you just start treating it right off the bat, a lot of times it just never goes into spasm. Like, you unwind the neck enough, and it sounds like you got a good chiropractor who's going to watch over any soft tissue potential problems that you might have, and deepen the breath and everything, and that you're not having a psychological response is really good. In cases like this, one of the very first things sometimes I don't always do it, but anise or anise could be very good.
Can I use ANS support?
Yeah, you could use, that was going to be my second thing, is if you don't have that, use ANS support. Put like 2 or 3 drops in water and just do that daily, just for the next, several days, just to calm down the sympathetic response in the nervous system. And the thing with that also is it helps to balance out the nervous system. Lemongrass, like diffused, or a drop or 2 of that in water, or really just inhaling it is enough. The lemongrass should be helpful.
Anything we could substitute for lemongrass? That's one I don't have yet.
Sure. So let's see. So lemongrass could be, this one's a little bit more obscure, but let's say cubeba would be one. Angelica might work. Blue tansy could possibly work.
I don't think I have those yet.
Let's even just have you inhale the ANS support. Let's make it just not super complicated. Still take it internally. Still take the ANS internally, but let's have you just inhale it a couple times a day, 10, 15, 20 breaths. Rotate that with the hyssop, and that should be okay. One of the things that if you start to feel fatigued, like a couple weeks down the road, a lot of times with whiplash patients, I would mix Ravensara, thyme, linalool, and oregano together. And that strengthens the body, strengthens the immune system, and increases energy levels a little bit. One of the things that can happen with a whiplash is that over a period of time, it throws your sleep off a little bit, and it will start to make you fatigued, and it just starts like an inflammatory process in the body. And so just nip that in the bud. If that starts happening, just start treating it immediately. And so you already are putting things in place that would actually kind of address all of that. So I'm not super concerned about it, because I think you're already putting things in motion that should knock all of this out. But
I used galbanum the first 2 days.
Yeah. Oh, beautiful.
Yeah. Robin suggested that.
A little bit of black cumin if you're feeling that there's some inflammation. But my number one priority is like the deepening of the breath with the hyssop. Because when you use the hyssop, you're relaxing the sternocleidomastoid, which are those two rope muscles that kind of come from behind your ear and go down to your collarbone and your sternum, it relaxes the diaphragm. And so if you do that, a lot of times, if you catch it early, a lot of times, a lot of the other symptoms don't even manifest, because they really manifest because of that area malfunctioning. You know what I mean? And so like if you just nip it in the bud like that, you're probably okay. Especially, it doesn't sound like you had too many injuries other than, you had the movement with the neck and the head and all that from the side impact. Did you see them coming, or were you blindsided by it?
Blindsided.
Okay, that actually is better. Like, believe it or not, because sometimes when you see it coming, you tighten up, and it actually makes the injury worse. And so that you got blindsided by it is actually, I mean, emotionally it's a little bit more traumatic, but physically it's actually a little less traumatic.
Yeah, and that makes so much sense.
Yeah, because if you think about it, if you see it coming, you tighten up really, really hard, and then it really injures you. Yeah. And so the best thing you can do, one time I got hit from behind. It was a big car, it was an old big car, but I saw them coming. It was in stop and go traffic on the freeway, like in Pasadena or something. And I saw them coming. I think they were probably going like 40 or 50 when they hit me. I took my foot off the gas. I took my hands off the steering wheel. I was just like, I knew I was going to get hit, but I had done all this therapy and whiplash. So I didn't even try to brace myself. I just let my body kind of flop back and forth. I walked away with no injury. The car is actually amazing. The car was totaled. Like the car
also did a good job.
Yeah. And so, that's the thing. Like if you're blindsided, that's kind of what happens to you, is you don't really see it's coming. And so you don't really fight the impact. And that actually usually is better for you. And so just if you do the things that we talked about that we already have in motion, and just do the thing with the hyssop and deepening the breath, you should knock down a lot of the symptoms, if not all of the symptoms.
I feel like, I had just come from acupuncture, so I was pretty relaxed, and I'm sure that was a very good thing.
Oh, even better. You had the good karma to get hit when you're like in a nice, relaxed state. I laugh because I once told Master Toa about, spiritual teacher, about like I got into 3 or 4 accidents all real close. And one of them was this one accident that I'm talking about. And he said, you have the good karma to be like aware and didn't tense up. But, he basically went through all the things we're talking about. And, I never really thought about it like that, but it's like, the accident was going to happen, but that you were loose and relaxed and didn't see it coming and didn't tense up. All that is in your benefit. And so, yeah, I would just treat the things. There's an extra little trick that you can do if you want. And so you can take like the hyssop and take like maybe like 12 or 15 long, slow, deep breaths, right? And then, you're just inhaling through the nose, exhaling through the mouth, like the way that we've always talked about. And then like take a long, slow, deep breath with the hyssop and then hold your breath, so you've got your breath, you're holding it, and then turn your body like side to side,
that makes so
like
much
a couple
sense.
of times, and then exhale. And then inhale again and hold your breath and turn your body side to side again. And you'll manually release the diaphragm.
I love that.
I used to have my patients do that in really severe whiplash cases. And man, that is a way to relax the diaphragm. And it actually rapidly cleans the solar plexus, which is the lower emotions from the event. That can actually be incredibly helpful as well.
Okay, I'm excited.
Yeah, good.
And I hope
that's something. If you have hyssop, you can do it right now. Like you don't even have to.
I'm gonna put the video on and pull up my hyssop.
Yeah,
I'm gonna turn the video off and pull up my hyssop.
Yeah.
Okay.
Perfect.
Thank you so much.
You're so welcome. You're so
all right.
welcome.
I hope I don't have anything else to work on.
If you do, keep us posted on all that, and we can just kind of go through and keep tweaking the adrenal issue and then also the whiplash thing, because both are something that are very, very common, and people can learn from these situations, even if it might not apply to them right now. Who knows what's going to happen in 6 months, and it's better to know, especially whiplash, it's better to know how to treat it as quickly as possible, rather than waiting a week, a month, a year. Most times, like when I was treating a lot of whiplashes, it was people coming to me like after 2 or 3 years of having the issue. And so much harder. It's still very treatable, but it's much harder to treat then versus a week or two out or a month out from the incident. Way easier to treat early on. Yeah,
well, like the piece you just did with the previous woman on the panic, it's something I'm going to invite one of my clients to use. So thank you.
Oh, good. Yeah.
Yeah.
Sometimes the panic, sometimes we have to tweak it a little bit, depending on what it is. But the one that we just talked about, that should work for a lot of them. Sometimes it can be a little bit more psychological. And so with that, I usually use something like helichrysum or poplar. But one of the ones that I use sometimes when it's more psychological is cistus. And the reason why I use cistus for like a phobia like that, when it's more psychological rather than physiological, is that cistus really helps you to see things that are like in the shadow of like your mind, like they're kind of buried, they're unconscious, they're not really there. So it helps bring something to the surface and bring it to your awareness so that you can kind of process it and let it go. And a lot of times with phobias that are in the mental body, it's there, but people usually aren't aware of it. It's not something until it starts to get released, they'll go, oh, it was something that happened when I was like 4 or 5 or, something like that. And so one of the variations would be like to use cistus, but that's when you're pretty clear that it's more mental than physical.
All right. Well, thank you again.
Yeah, you're so welcome.
See you later. I'm here. I'm just going to unvideo myself.
Okay. Yeah. Keep us posted. Keep us posted.
Okay,
yeah.
I will.
Hi, Greg.
Hey.
Hi, it's Miriam. How are you?
I know that. I know that voice.
How do you know that?
I can tell even by just the way you say hi.
Oh.
Well, it's just because I know you so well.
Yeah.
How are you?
Last week, I tried to ask you a question, but I lost my my sound, so I couldn't I couldn't share everything I wanted to share. Got this 80-year-old man who has a lot of things going on with his body. But the main thing that he's got going on right now is that he has asthma, which he's had his entire life. And he was put on Dupixent and Fasenra.
Okay.
Anyway, they're I guess really serious medications and very, very expensive. And he went into major allergic reaction with them. So he can't handle. They don't know what to do with him. And so you gave me, you did make a lot of suggestions, but I was wondering if you could get a sense of him and just grab it from there.
Okay, so just with a little bit of information that you just shared. So I think we probably talked about quercetin, right? A lot of 90% of asthmatics that's not exercise induced is they are vitamin C deficient. Their body is just utilizing so much more vitamin C than normal. And, it could be a blood sugar issue. It could be just inflammation. It could be, other reasons, immune issues, who knows? And that part's not important. It's just that it's consuming lots. And so, quercetin becomes like a primary component of treating it, and you kind of go big with the dosage for a little bit. Like people who are having allergic type asthma, you can do 3 capsules 3-4 times a day. It's usually well tolerated. You don't have the issues like you would with vitamin C, where like if you take too much vitamin C, it gives the body, loose bowel movements or diarrhea. And with quercetin, you don't have that issue. But if you want to start slow a little bit, it's understandable. But that's helpful. Cordyceps, which is a mushroom, that's not so much for the immediate, that's more a long-term treatment. That is usually the dosage is 3,000 milligrams, which if it's in capsule form is usually about 6 capsules. I find it cheaper if they can handle it. It's a real bland taste. And so there's places where you can get a good quality cordyceps that's a powder, and they can just take the equivalent 3 grams, 3,000 milligrams is basically 3 grams. And so Shaman Shack has a really good cordyceps that's a powder that you could give him, because the thing with cordyceps is you have the mother mycelia that they grow the cordyceps from, and at about 5 generations from that mother mycelia, the cordyceps potency starts going down. And most companies, they have the mother mycelia and they don't change it out for sometimes years. And so what happens is they just keep producing weaker and weaker cordyceps as time goes by. And so even taking 3,000-4,000 milligrams is really not very potent. And so, I'd get from a company that is pretty solid. And so Host Defense is pretty good. It's already in capsule form. Shaman Shack, it's not in capsule form, and it's cheaper that way. To do the powder. So it keeps it cost effective. But if he was only going to choose one, I'd much prefer him being on the quercetin right off the bat. Now, here's the other thing that I would say about that. There's definitely oils that you could use to improve the breathing. Hyssop being one of them, especially decumbens. Larch could be one. There's several oils that could be helpful. But one of the things that you see when, and I don't think we talked about this last time, but we talked about like maybe putting them on 4 or 5 100 milligrams of magnesium. But the thing is a lot of the like inhalers and the medications that they use to treat the asthma actually depletes the serum levels of magnesium in the body. And so like one of the indicators that you would see for this when it gets really bad is, for one, he'll get cramps all over his body. And a lot of times they'll get headaches. Like they'll get these just weird tension headaches. And sometimes they've had them for so long that they just think that's the way you feel. They don't really even know sometimes until the headache goes away. But like you ask him if he's cramping, you know, in his feet, his legs, his calves, you know, if he cramps real easy, or if he's getting headaches, if he's grinding his teeth a lot. All of these are indicators of really super low serum levels of magnesium. And so he'll need to take magnesium regardless if it's low or not. He'll have to take magnesium for a while, because the magnesium also relaxes the bronchioles, and the bronchioles are part of the problem. You know, they're in a spasm, right? And so when you go through and do that, you can only take about 500 milligrams of magnesium before it starts making you have loose bowel movements. Like sometimes you can squeeze in like 700, but if you're to take 1,000, you're going to end up on the toilet, you know? And so one of the ways to increase magnesium without it having an impact on your bowels is having still do the 500 milligrams on you know, the regular mineral, but then you can augment that with wood betony, which is an herb that you'd get off of like Amazon. Don't get it in a tincture form, because the ones that I've like tracked down tincture wise on different health companies, it's too weak. Like somebody needs to be really overseeing like how potent it is, but you can get it in capsule, and just get the capsule and have them take a couple of capsules. That will boost his magnesium levels quite substantially without it causing the bowel movement. And so the other thing that I would have him do is, you know, because the bronchioles are in such a spasm, is have them do that pursed lip breathing, you know, where you inhale through the nose and then make the lips really tight, and then, you know, force the air out of the pursed lips. You know, you're making the lips just really super tight. And when you go through and do that, you do like, you know, if they can do 5 or 6 of those at a time, that would be really good, but you're manually opening up the bronchioles. And so that would be a big one, I think, to augment all the other treatments, be it energetic or, you know, the herbs or the oils. The other thing is, you know, exercise-induced asthma is usually a deficiency of like, you know, basically fish oils and things in the body, you know, those omega oils and things. And so you can have him take fish oil. It's probably not going to have a big impact, but you know, given his age and everything, I mean, it wouldn't hurt, but it's probably not going to resolve it. But if you're wanting just to do like a little bit of everything, you can do that as well. Psychologically, the issue would be a repressed trauma. Doesn't mean asthmatics have repressed traumas, but if you're doing all these things and nothing seems to be working, you can start looking at repressed trauma. And with that, helichrysum can work. Helichrysum supreme is a little bit stronger. Poplar can be very good for that. And this sounds like a weird one, but the trigger point blend actually can be very helpful. And the reason why the trigger point blend can be very helpful for something like this is it helps to calm down like a certain kind of tension in the body, and it helps stimulate some processes that would happen in the sleep. And one of the byproducts of trigger point activity in the body is it impacts your cognitive functions mentally, and it impacts abstract thinking, which is new and abstract processing, but also it's impacting the generation of like thoughts and thought forms. It impacts the unconscious, and it impacts the ability to form strategies of like how to resolve the issue or how to resolve the problem, or it shuts down like kind of long-term strategic thinking. And so when you start to see a lot of trigger point activity in the body, where, it's a lot of trigger points are not just tight muscles, they're tight muscles that start to cause like neurological dysfunction. It starts to throw off the sleep. And it, like if you think of trigger points, a lot of times we just think of the points themselves, but it's like, think of it like this, is like different muscle groups, they work best when they have differentiation between each of the muscles. Like, you have quadriceps, and within the quads, there's one that's more in the inner part of the thigh, the one that's in the middle, there's one on the side, and then there's a bigger one that's on the middle on top. And so if there's poor differentiation, then like if you were to move and the one on the inside of your leg is really the only one that needs to move, all the other ones fire off at the same time, and sometimes even other muscle groups fire off. And so sometimes what happens is when they start to have their breathing issues, is that all the muscles are almost like kind of wired together, and they don't have the differentiation of being able to take the long, slow, deep breaths that normal people do. They're breathing more in their chest. They're not able to go down into the abdomen. The diaphragm's wound up. The muscles around the thoracic, the chest, the thoracic cavity. There's several muscles there that help to elevate the ribs to move, right? Now, not to throw you a curveball, but if you explore all of this, and you're just like, nothing's still working, right? Sometimes, like you'll have people who are going to the doctor, and they'll be looking at the lungs and everything looks fine, but they still have asthma. Like they're still having an asthmatic response, right? It's actually the vocal cords. And there's a thing called paradoxical vocal cord syndrome. And with pranic healing, you could go in through the throat minor with delicate regeneration, the greenish violet, greenish yellow, electric violet or gold. But with essential oils, like Roman chamomile, Cape chamomile, German chamomile might work, but Roman chamomile and Cape chamomile usually work significantly better. Every once in a while, maybe even Spanish sage might work, and you just have them inhale it. You don't even have to have them directed, and it will start to flip the vocal cord. Usually this only happens if they have a thyroid issue, or they've had some procedure on the neck, they've had a scope go down their throat, they've had really bad injury to the neck or really bad sore throats. It's usually something along that line. But even a whiplash could do it. But usually it's more thyroid related. But if nothing else is working, you really have to explore the vocal cord, the paradoxical vocal cord syndrome, because it looks just like asthma. It looks exactly like asthma, and they're non-responsive to every asthma medication.
Okay.
You know, and so like if he's already been on a whole bunch of medications and he's not really responding to them, you might even start with that, you know, just to cross it off the list.
So, okay, so for this one, would it be internal?
Actually, no, you just have him inhale it. Yeah, just have him inhale it. Yeah.
Okay.
Yeah,
and
for the chamomiles, I mean, he would have to do it a lot. He would have to do it probably 3 or 4 times a day, 25, 30 inhalations. You know, because paradoxical means that it got so overstimulated that the nervous system actually flipped. Like, you know, it's doing the opposite of what it's supposed to do. And so what happens is when the vocal cords open, it closes. And so like when they're usually like using air to like talk or breathe or whatever, the vocal cord keeps doing the opposite of what it does. And they just can't get the rhythm of like how to breathe and do their thing. And so to everybody, it looks like asthma. You know, it usually takes somebody who specializes in that vocal cord syndrome to even like recognize it. Like it is super undiagnosed. Like it is just, the only reason I know about it is because of all the people that I treated with super serious whiplash.
On the magnesium, did you say the wood betony in place of the magnesium?
No, do them both. Yeah, do them both. Like about 400 to 500 milligrams of just the standard, you know, magnesium, you know, and then, and like have him take it internal. Like sometimes people will do the thing where they'll do it topical. It doesn't usually raise the serum levels enough. Like he needs to take it internal. But the betony would be to augment the magnesium so that you can get much bigger dosages of magnesium in the body, which reduces spasms, including spasms in the digestive tract and respiratory tract, which would be the bronchioles. You know, you'll just calm them down. And so it makes it easier for treatment to settle in. You know, it's not usually the cure, but if there is significant spasms and cramping in the body, no matter what you do, you're dealing with a body who's just fighting it every step of the way, just because of the lack of minerals.
And the trigger point blend, is that internal or is that inhaled?
No, that would be also just a lot of deep inhalation. You could make it into like a liniment or like an ointment and have him rub it on the body. But to really unwind some of the tension in the body and improve the sleep, you would need to inhale it, you know, like out of a bottle, or have him put a couple drops on and just long, slow, deep breaths.
Okay, that's a lot. I'm going to try to put it into outline form.
Yeah. I mean, like really serious asthma. I mean, you know, it can be a tough one to treat sometimes. And so, you know, like one of the things, these are like a really good place to start with all of this. But sometimes you even need to like go through and look at like treat the digestive tract and treat the skin. And, you know, that's more long-term treatment. Right now, you want to get him out of crisis. And usually, I'd say 90% of the time, maybe 80%, usually the quercetin with magnesium will usually get people off serious asthma medications and inhalers and things within about 30 to 45 days. You know, sometimes it takes a little longer, but usually you can get them off of it. But when they're not responding, it means that there's something more serious going on and you have to start looking at other issues. And so, you know, you just start doing the ripples and start treating other things and just making other things right. And sometimes it's not one big thing, but you just going through and correcting a bunch of pieces, and then eventually it'll flip. But yeah.
About a year ago, I suggested that he try hyssop, and he loved it. He loved it. I don't know that it kept. I don't have a lot of contact with this person, but then he went into trying to get the other these bigger medications to work.
Yeah.
And now we have to, and now I don't believe he's on anything. So it's not good this way. Anyway, so I'm going to go over all the stuff and see what they can absorb.
Okay. And, just the thing was like the quercetin. I mean, we back in the day, I mean, this was a while ago, but I mean, I had individuals that were having such severe allergic asthma that I had them take 3 capsules every hour for like 8 or 10 hours or something. I mean, it was like, we even ran down a place where we could get it in liquid so they could do it like sublingual. And, you just got to make sure that's got bromelain in it. But
wait, what has bromelain in it?
Quercetin. All the quercetin formulas have bromelain in it, unless it's like some cheap version of quercetin. Like you usually don't have to worry about it, but it all comes with bromelain. Yeah.
Okay.
And so even the thing where you have them do it every hour, that seems like pretty excessive, but when they're in the middle of a crisis, it'll pull them right out of the crisis like 90% of the time. I mean, it usually works really super well, because part of the allergic reaction is high levels of histamine. And when you start taking the quercetin, it almost instantaneously starts lowering the histamine levels in the body. And so the thing is like you can be allergic to something, and then if you treat it, all of a sudden you're not allergic to it anymore. Like it is really more about the histamine levels than it is about the being allergic to something. And so if you can just lower histamine, you usually can pull them out of it, usually. But, there's always complications that can happen in a part of the population. And so, you want to kind of go into it knowing what to look for and how to problem solve. And so, you definitely have a lot to work with there for a little while before you would look for more things if he's just not responding.
Okay. Thank you.
You're so welcome.
Hope to see you soon.
Yeah. We're going to see you here in just like about a month, I think, right? And tell Dave hi from.
I will.
Yeah.
Okay. Thank you.
Go ahead, Sandra.
Hey, Sandra.
Hi, Greg. I was wondering if I might address Megan's claustrophobia.
Sure.
I also have had the same sort of claustrophobia my whole life. Sometimes it's been almost non-existent. Other times I've had panic attacks. I met a woman at a pranic healing workshop who was a medium, and without my asking her, she said, "Would you like to know why you have claustrophobia?" And I said, "Well, yeah, I guess." So she told me that I had 2 past lives where I had really horrendous things happen to me that had to do with being in small spaces. And I'm not sure I wanted to know those things, but it did explain why I sometimes panic like Megan did. So I don't know if she's thought of that, but I know people who do go to people who can regress you back to a former life, and for various various problems, and that has helped them tremendously. So that might be one approach you might take.
Okay. Well, thank you.
And back to Megan's thing, someone did ask when you were seeing the cranial pattern, what was the other pattern after that?
The lower chakral pattern.
So this is gonna take me, it's a little few parts. So I've been feeling super drained of the energy and depressed the last couple of weeks since breaking up with my partner. I've done a number of things to cope and process, and I'm open to doing whatever necessary to bounce back. I thought I made the right decision to split and was okay, but it's been kind of rough, worse than I thought I would feel from it. I have a deadline for some important work this week and another next, but have been feeling zapped and unable to work. Any recommendations on that? In addition to this, let me get there. And in conjunction with the breakup, I've also been struggling with sleep and have had more anxiety. Now, you had given them a little bit of a recommendation with some sleep stuff. I think it was last week or something. They said I have been drinking and smelling tarragon a lot, particularly at night, and smelling helichrysum and spikenard extra at night.
And is any of that helping?
They said maybe some, but I've only
but not enough.
Gotten decent sleep for 2 to 3 nights in the last 2 weeks. I'm kind of hobbling along through my days in survival mode and feeling pretty sketchy.
So sleep issue, fatigue, performance. Sounds like also a little bit of being overwhelmed by emotions, maybe.
Yes.
Yeah. Okay, let me just sit with it for a minute. Are you consumed with your thoughts about the ex-partner, or like spending a lot of time thinking about the what ifs and the hypotheticals?
On and off, yes.
Yeah. You know, it seems a little bit counterintuitive, but I would say let's have you maybe try in the mornings doing, taking a couple drops of like cinnamon or cassia, some form of cinnamon or cassia. And, so here's my rationale. And, we might have to revisit this in a couple of days, but here's my rationale. Okay, so for one, cinnamon cassia is very activating to the heart. It's very activating to the heart. It strengthens the heart and it helps the heart to process. It also helps with integration. I wouldn't say integration necessarily with trauma, but just integration of things you're trying to bring into your life, things that might be different, things you might be changing, those kinds of things. It is very strengthening to the body. And any time you're looking at where you're having a little bit of some depression, it is a little bit too much of being introverted and not enough being extroverted. And the thing about being a little bit more extroverted is, like introverted, you're spending a lot of time like reflecting on a situation, reflecting on the potentials and the what ifs and everything, where when you're being a bit more extroverted, you're putting things in motion and you tend to be a little bit more like thick-skinned, so to speak. And so you're just having like a temporary time of being a little bit maybe too introverted. It's not that it's too introverted, it's just it's getting like stuck. You're getting stuck in being introverted, which is kind of normal for going through a breakup, especially if you've been with a person for more than 6 months or a year or something. I mean, it's really kind of normal. And then not feeling super super sure, is it the right decision? Is it the wrong decision? Like being a little bit more extroverted is you'll either move past it, move on. And, even if there's a little bit of pain of like, well, what about this? What about that? You're a little bit thick-skinned and can handle it. Or if it's that you're trying, you've thought about it, and you go, you know what? I want to get back with this person. The cinnamon helps you to take action to kind of go through and make that happen. And even if they say, well, you did this and you did that, and, push your buttons a little bit, you're a little bit thick-skinned to where even that doesn't even really fry you too much. You know what I mean? It allows you to kind of step back into the situation. And if you have to take a couple punches a little bit, you're able to take them and shake them off. And so, we went through and we looked at it from the point of view of trauma and trying to improve the sleep. But if that's not working, and there's, you use the word like you're feeling a little bit depressed or melancholy, or cinnamon is definitely good for that. And cinnamon would definitely help you either move on or go back and kind of work it out and take some punches if you needed to work it out. And the thing, again, what I said in the very beginning is the cinnamon is, it's very activating to the heart, but it doesn't make you like, it doesn't make you sensitive. It makes like the heart like kind of tough, like, okay, this is what I want. And if this means that, got to take some punches for a little bit to have this love in my life, then I'm going to do it. Or, you know what, I'm going to move on and I'm going to find a new love. Cinnamon can do that. Like cinnamon has the ability to do that and really not think twice about it. And it's not that you're thinking too much, but I think there's just a little bit, it happens sometimes when we do a lot of meditation. We naturally start to become more introverted because of the meditation. And so sometimes it's very good, but when it comes to situations like this, sometimes it can be a little bit of a stumbling block. And so, there's times where you just got to go, I just got to put something in motion. And so the cinnamon really won't help you think out what you want, but whatever you decide to do, it will help you to execute that. And so a couple drops in water, once or twice a day. Oh, sorry, I bumped this. Is it good? Yeah. Once or twice a day, but you can inhale it, several times a day. I would just say, like, as you get closer to the evening, maybe slow down with that, just because it might not allow you to sleep or sleep very well. But, start shifting over to doing some of the things like, for sleep. You could do some marjoram. Actually, even lavender might not be bad to do inhalation, just because it reduces some nervous tension. Spikenard, lavender, valerian, all of those can be helpful. Rue can always be helpful for cutting the cords between you and the individual, but also remember that sometimes it might need to be that the cords between you and the person need to be cleaned up a little bit because you're going through a breakup. So the ironbark eucalyptus, Eucalyptus citrodora, or the etheric cords blend can also be very helpful in just cleaning up the cords between you and the person. Sometimes even throwing a little basil in there can help with some of the releasing of the tendency to reattach the cords, if that's what you want. As a therapist all those years, like, I never got into a place where I told the person, you should be with this person or you should break up with this person. It is really a personal decision. And so, whatever I'm saying right here, I don't want to imply that or come across like I'm implying that you should break up with the person or stay with the person. That is a very, very personal choice. But whatever you end up deciding, cinnamon would be the primary thing. Cleaning up the cords would be a very good thing to do. And then if you are stepping away from that person, basil could be helpful just because it helps to reduce the reasons why we court each other a little bit. Rue would be good for just releasing and cutting the cords, as well as if you're a pranic healer, going through and cutting the cords between you and the person, but use perba or a disintegrator. Do a good cut. But it sounds like that might be a little bit premature for you. Like I think that you need to be pretty solid in your decision before you do something like that, because if you're not ready to have the disconnection and you disconnect, it might make you want to go back when it's maybe not what you want, but it's like a gut knee-jerk reaction kind of. And so let yourself kind of process it and be okay with it, and then when the time comes, go through and cut. Yeah.
Can I mix basil and tarragon in water?
Yeah. Oh, yeah.
At the same time?
Yeah, you could. For that, I mean, basil is really good for stress. Tarragon is really good for trauma. It's going to change the dynamic of it a little bit, but it would still be good for stress. It still would be good for soothing. But if you're really needing that soothing impact, tarragon, if you're wanting to explore some different things because basically we're talking about kind of like shock of the situation, and shock is not just the immediate kind of shock that's like, oh, this event happened. Sometimes there's like a long-term shock that can go on for weeks or even kind of months, where you're just kind of a little bit checked out. Tarragon can still be helpful for that. Rose can be helpful for that as well. One that you wouldn't think of being helpful for that is benzoin. Benzoin can actually be a thing that helps you have a little bit of space between you and the situation. And so that can actually be very helpful. If you're feeling that you're just like a little too checked out, try putting, you can try mugwort on the joints of the arms and legs, but an even better one is tuberose. Tuberose on the joints of the arms and legs helps you to not like be so checked out. But you'll have to gauge if that's what's happening or not. But I'd probably stick with trying the variations of like either benzoin or rose or tarragon for the shock of the situation. It's very calming and soothing to the emotional body, all three of them. And they all do variations of how they handle the different kinds of shock. All can be helpful, but sometimes you just got to almost like match it up to your personality type a little bit, or at least the situation. And so see if that helps. But let's definitely have you do cinnamon, and then clean the cords up a little bit. If you don't have the ironbark eucalyptus, do some healing on cleaning. Sweep out the cords. Yeah, I hope that helps. Keep us posted on that. Don't do the cinnamon at night. I just want to keep emphasizing that, because that is a great way to stay up all night. If you're having a little bit of anxiety, going back to like a shortness of breath also, you could also try the lang lang. Just inhaling when you're starting to feel, because sometimes when you're going through a breakup, you do start having a little bit anxious, like, what if that was the one? What if this the most love that I'll feel for a person, whatever it is. You start to have a little bit of anxiety. The lang lang will help slow down the breath. It doesn't deepen the breath, but it will slow down the rate somewhat. And hyssop usually does it. Sitka usually does it. Larch usually does it. But when it starts to be a little bit like more agitated, lang lang will actually calm that down and calm down the heart rate.
They said I've been putting cinnamon in my coffee for weeks in the morning.
Wow, and it's still happening. That's still happening. Okay, give me just a minute. I'm just kind of sitting with this. Let me ask you this. And it might not be conscious, but like if you think about it, is there a decent amount of anger involved? You know, even if it's from the past.
Yes,
Okay.
there's anger.
I think, okay, so keep doing the cinnamon, clean the cords, but let's augment that a little bit. I think we need to, because if you're doing cinnamon and you're still having this issue, there is a psychological component that is there. And even if it's in the unconscious, it needs to be addressed. And usually when you're starting to feel a little melancholy or like depressed, especially in a situation like this, it's usually anger. Like it almost, it's just mechanics, And so Roman chamomile or Cape chamomile would be really super good for that. German chamomile would be good, but the Roman or the Cape chamomiles have a bit more of a psychological effect, where the German chamomile is a little bit more of a physiological effect. And so for this, I would have you put a few drops of chamomile in water 2 or 3 times a day, and inhale it as much as you want, and put a few drops on your wrist as much as you want. But let's try that for a few days. And then if you're doing some healings to augment the things with the oils are going to be strong, right? Because the thing is with the oils is it scent affects the part of the brain that can change your thinking and change behaviors, right? But still, if you're going to do some healing, focus on mostly the solar plexus and just anger. Just like go after anger, just unconscious anger. Just focus on the anger. Yeah. A lot of times you still have to clean the basic a little bit, the navel a little bit, but a lot of it's just in the solar plexus.
And then I'm going to ask this chat, and then Kathy will get to you next. Someone asked, we have a difficult client that lashes at my team when we make mistakes. He gets very angry and rude, a huge pain, really. I've been diffusing hyssop during our calls, doing meditation of twin hearts, blessing and forgiveness. Anything else Greg can recommend?
And okay, so when you're doing this, it's he's on a call. So like when you're diffusing the hyssop, he's not really inhaling the hyssop. It's the team's inhaling the hyssop. And also, what kind of work is this? Is this like corporate? Is this IT? Is this psychological things? Like what's going on? You don't have to give me a lot of details. Just give me an idea.
Corporate, just a sec.
Okay.
And they are the one just inhaling the hyssop.
Okay,
during this
so that prevents you from having the hyssop will keep the team from absorbing the negativity from that person, but still the outbursts and the expectations, and sometimes people are just, it's their personality, or they have like a sense of entitlement. And this is weird thing to say, but sometimes, how, like you said, you're blessing them with twin hearts. Sometimes that loving energy, they unconsciously sense that as like a weakness, and it actually will make them worse. And so if the blessing isn't making it better and making them calm down, I would actually probably stop. It doesn't happen often, but it does happen sometimes. Do you have a dorje?
Yeah.
Bless the situation with the dorje. Just like do like little circles and do like Om Mani Padme Hum, or actually not Om Mani Padme Hum. Om Namah Shivaya. Do Om Namah Shivaya. Bless it with a dorje, and especially him with a dorje. And do it daily for like a good week or so. And then let me know like how that's changed. But it's sometimes you're dealing with people just being reactive, and then sometimes you're dealing with people who have personality defects. It's just, it can happen. And even though it's in the corporate world, people get aggressive, they get hostile, they have senses of entitlement. The best thing you can do is not a loving approach, but bringing in light to the situation, because light will usually either make them change their behavior, bring some sort of consequence to their behavior, to the thing. The dynamics of the situation might change. But usually when nothing else is working, and it's not like you can have them inhale the hyssop as well. So I think the dorje is what has to happen in that situation. In the corporate world, that's exactly what I would do. My next thing would be just blast that with a dorje.
They said, I think he is borderline. And
he sounds like he's got a, I'm not trying to diagnose him, but he sounds like he enjoys being difficult. I would say that he takes advantage of situations, and anytime he senses weakness, he probably goes for the throat, which means he's being very much driven by his lower nature. There's not a strong sense of fairness in any of these situations. And so if you want to send that situation to me, and I'll also put it in when I'm doing my daily, for a start, I go through and do prayer requests on a daily basis, where I go through and bless things, and I'll put it on the list.
We have 2 minutes. Someone did ask, what if we don't have a dorje?
If you don't have a dorje, usually I would say you could bless chanting Om Rama Om. But in this particular case, Om Namah Shivaya can be helpful, because it's a little bit of creative destruction. It's a little bit of a willful energy. And really, to all people concerned, when you're using Om Namah Shivaya in a situation like this, you're breaking down everybody's pride, like negative pride. And so if it's people on the team, which I doubt, but people on the team, it breaks it down, but also in the individual, it breaks it down as well. And so it just, you know, it either helps him to like either adjust or go away. But, you know, there's just times where there's people who are just obnoxious. You try to survive it as best you can. And, you know, I mean, it's hard. You try not to take it personally, but, you know, if you can't walk away from the situation, then you try to make do with what you got to do. And the Dorje, Om Namah Shivaya, Om Mani Padme Hum can be soothing, but somebody like this, sometimes they see that and they go for the throat even more. And so it's very rare, but it's usually they have some sort of, I think clinically and therapeutically, we call that person a jackass. And so, you know, hard to stop somebody like that sometimes. So you just do the best that you can to survive it. And then, you know, try not to be too harmed by it when you're having to survive it, which, you know, doing the hyssop really helps. I might even have your team like, or diffuse like rue after the fact. But yeah, the Dorje Om Namah Shivaya.
And it is 7:30. Guys, the ones who typed in chat, we didn't get to you. If you want to go ahead and try and email us or post it on Plant Prana Q&A, email us at info@plantpranaoils.com, and I'll see if we can get to those. But we do need to get over to our other session. Thank you guys for coming.
Love you guys.
I did post, and so you guys are the lucky ones who get the link for the angel session. So I'm going to repost it right now again. And
tomorrow we are not doing Wednesday night. Unfortunately, our travel schedule is just going to be too close. We might be able to pull it off, but it's like 50-50 with that we're going to be where we need to be. So let's not even do a last minute cancellation on you guys. Let's just say that we're not going to make it, and we'll be back on the following week. So
okay.
Apologize for that.
And I know Zoom can be a little tricky going from one to the other. I will check my emails if you guys weren't able to catch this. So I'll be checking the emails to let you guys have this link that way as well for the angels. Thanks, guys.